When seconds count, EMTs can mean the difference between life and death. Yet a shortage of funding and workers are putting these vital services in critical condition, especially in rural areas. As our Brian Bindley shows us, small towns are struggling to keep their EMT services alive.
When disaster strikes, an ambulance service is one of the first to respond. But what happens when disaster strikes the ambulance? Or even worse, the technicians who save lives.
They hit an icy patch on their way to the hospital. When it went off in the ditch, it hit nose first, turned back down the highway, caught a rock on this side, rolled up onto the left side, slid, and then flipped completely over and back onto its wheels facing the highway.
And taking the life of 51-year-old emergency medical technician Janez Case of Clayton, Oklahoma.
Whenever you're working the ambulance and you have the cot in here, you're moving about to take care of that patient. And our medic was moving around when the ambulance wrecked. She slammed into the cot,
where Case sustained the majority of her injuries, giving her life to save the passenger. And now that she is gone, Clayton is without. Todd Boffman, director of Clayton EMS.
The EMT that got killed in the accident was covering 5 days a week, 24 hours a day. That is a huge responsibility that we're having trouble filling that void.
For the first time in 30 years, Clayton and its surrounding 800 square miles could be without an ambulance service, a service that is dependent on volunteers.
If you have one and it's my child, it's extremely critical, and I want to make sure that we have an ambulance service here to take care of my family and our community.
Gary Batten is the executive director of healthcare with the Choctaw Nation and is not only a citizen of Clayton, but also the full-time employer to Boffman, and says it is important for surrounding businesses to support the volunteers and the EMS.
I think a lot of people don't even think about ambulance services till they need it. You know, and just like here, we're at a catastrophic situation where if we do not continue our ambulance services, then people won't think about it until it's gone. But by that time, it's usually too late.
And even though a new ambulance has been delivered to Clayton and will be covered by the insurance, it still doesn't mean it will be put to use.
We're taken care of as far as getting a truck. Without the staffing, the truck really doesn't do a whole lot of good.
And it is because of unfortunate events like this, as well as a decline in services, that the governor was asked to assemble a task force in October of 2005 to find an answer to an already growing problem.
I think that the question that they had to answer first is there a problem? And the answer to that is a resounding yes. EMS in Oklahoma is in deep trouble.
Now, 16 months later, the task force has submitted their final proposal to the governor. Sean Rogers, director of the Emergency Medical Services.
We had 45 ambulance services close over the last 5 years. All of our ambulance services are financially threatened. And the reason for that is that Medicare has cut back sharply on what they pay for ambulance runs, and that has been the traditional funding mechanism.
Which is just the tip of the iceberg. EMS providers respond to more than 325,000 calls each year, and paramedic service is only available in 25 of the 77 counties, with the highest concentration in urban settings, leaving rural Oklahoma to fend for itself.
It isn't a question of getting to the hospital, it's a question of getting hospital-level care to the patient.
The task force is proposing a multi-layer solution, starting with taking the cap off the ad valorem tax that allows for emergency spending so communities can tax themselves, as well as seed money for regional systems so communities can work together, something LaFleur County EMS is doing to help the citizens of Clayton. EMS County Director Bob Hawley.
When they lost their sole ambulance down there, then the next closest service was going to be out of our station in Tallahassee to run down there, and that's still over 30 miles to get there. And if you're dealing with a heart attack or something like that, every moment is of essence.
And it also puts a strain on their financial budget, not to mention the people they are trying to save. LaFleur County has 5 ambulance services covering over 1,500 square miles, and transportation to a major hospital can take well over an hour.
In rural Oklahoma, we don't have the benefit of a trauma center within 10 minutes or 45 minutes of the areas. And the local ambulance service, again, is just as important as a fire department or a police department. because when it hits the fan, then you're not going to load them in the back of a pickup and get that ER type quality care in the back of a pickup. You have got to have the local ambulance service.
And the third request is more funding for technicians, many of whom are currently volunteers and have to pay for training out of pocket.
They have to leave their community and their families and their full-time jobs to go get this training, and they have to not only get their initial training, but they have to maintain that training every 2 years.
Gina Riggs is the EMS director for Kiamichi Technology Center in Poto and says over 90% of EMT graduates come from local career techs, and much of the success is due to video classrooms, allowing one instructor to teach many across the state.
6 years ago, we only graduated one paramedic student from our program, and then we started the distance education program, and last year we graduated over 30 paramedic students in our program.
A promising sign for a much needed occupation that relies solely on quality people who are willing to give more than they receive.